You're watching continuing coverage of the 7th Annual World Healthcare Congress in Washington, D.C. I'm Mabel Jung. Stay tuned for my conversation with David Cordani, President and CEO of CIGNA, about his company's plans to keep healthcare reform on track. What was the reaction like within CIGNA when we heard that this bill was signed by the President and that we are going forward to reform the healthcare system as we know it?
Probably a few reactions. There wasn't just one reaction. One was, I think everybody, whether it was in CIGNA or outside of CIGNA, was pleased to have some certainty because it's been a long year, and it's been a long, exhausting year for some. Second was some pleasure that access is indeed getting expanded, because we believed, and we've been very active with our employees as well as our customers and the government, that access needs to be expanded, and that's good for Americans in the broader sense. So recognizing that access was expanded, but frustration that the other two priorities were not moved forward effectively, which is sustainability of cost and quality improvement, which requires prevention, wellness, some payment system reform. So a few reactions. Again, pleased to have clarity, satisfaction that access is expanded, frustration that the quality and cost part of the equation wasn't addressed, which really worries people that it might not be sustainable.
Will it be difficult to really change how people are compensated in the healthcare industry? What is the biggest challenge?
So I think the biggest opportunity, I like to think about life in opportunities. There's many challenges in life, but they all convert to opportunities. The biggest opportunity is to take the information that we have, that the industry has, that CMS has, and use it to reward those physicians or hospitals that are providing the best quality and therefore best value, and try to provide transparency and visibility for individuals of what's transpiring there. And then use that same information to pay less or provide the feedback to physicians or hospitals that are providing less consistent quality or lower value. That's where the opportunity is. We have a good dozen pilots around the country right now that are running to do just that, with forward-looking, well-minded physician groups or hospital systems, and driving forward with the use of information to get the best quality outcomes for our customers.
And what are some key components to those working well?
The key component, I would say, number one, you need a philosophical buy-in. You need the leader of that hospital system or a large physician group to buy in. Let me give you an example. We did a medical home with a very large physician group in North Texas. I personally sat with the management team and the CEO and had breakfast one morning at about 6:30, because many of them are practicing physicians, to understand what they were trying to accomplish and why. So number one is philosophical alignment, recognition that things need to be done differently, and it's all to benefit the individual, their patient, our customer. That's one. Two, a commitment to use information, to use the facts and fact-based information, and iterative dynamic feedback. And then three, an agreement to modify the incentives, to modify the spending, if you will, and that they will actually vary the way that they reimburse their own physicians as a result. So philosophical buy-in, commitment to information, and then the use of the incentives, both dialing up and dialing down for individuals.
Okay, so universally, what do you think will be the biggest change that a consumer will see in going to see a physician and maybe having to seek greater care outside of that?
So over the near term versus the intermediate
near term first,
I would say over the near term for employers, and the majority of our customers in the U.S. are through employers. That's how we go to market. We see a tremendous increase in terms of the energy around health improvement, wellness, the use of incentives, financial responsibility for the individual, and information. So I think what individuals will see over the next couple of years is a lot more expectations of them to become more retail purchasers of healthcare, and using the system and using the information and having incentives over the next couple of years. And that's a good thing as long as the programs are designed effectively. There's a real positive outcome. Health improves, engagement improves, the way the resources are spent improve.
Oh, okay, and so how do you see CIGNA being able to compete for that consumer's interest?
Yeah, we're rather excited about that, because as a health service company, we've been focused for the last 3.5 years orienting ourselves around the individual consumer. For example, we're the only company in the States who's open 365 days a year, 7 days a week, 24 hours a day, right? Because we need to be there when our customer is there. We've won awards for our electronic tools that are very intuitive for individuals. We employ over 3,000 clinical professionals today that act as health coaches, lifestyle coaches, etc. So we actually like that environment evolving because strategically that's where we believe it needed to go.
Do you think that there has been much progress or education in that area? Do people realize that in order to stay well, they need to keep well in the present and not just fix problems when they're broken?
It's mixed. So when you take 300 million people in the United States and the thousands and thousands and thousands of employers, it's mixed. But what I would say to you is, like any change in a business, you go from the innovators to the early majority to the masses. Bill Weldon, who was in here speaking earlier, he was an innovator. His firm, J&J, was an innovator 20, 30 years ago around this. The innovators are through. The early majority is through. So there's increasing demand and awareness around this change. The level of interest I'm seeing today is at the highest level I've ever seen. So I think we're in an environment where it's building momentum for the positive.
Okay, and are you working closely with individual states as well to try to get these exchanges that we're hearing about up and running?
Well, we're working actively both with the White House administration, so the Secretary's office, as we have been over the last year. We're going to work very closely as well to offer any resources, any capabilities we have around as the legislation gets converted to regulation. Similarly, to your point, in key states, we are and will be very actively engaged to try to get the regulations converted and then implemented in a way that puts the individual first, and a close second, their physician, to make sure that we're actually strengthening that individual-physician relationship and using information to create something that's sustainable.
By 2014, a dramatic number of people will be entering into the system. Does that make you nervous at all?
That level of change?
During that level of time?
Excited and interested is what I would say. So nervous could be a way to look at it in terms of it will be disruptive. If you look at Massachusetts, for example, that expanded access, they immediately realized the problem that we're going to see in the country, which is there's not enough primary care physicians to provide the accessibility. Access is there, there's doctors, but accessibility, the wait times actually have grown up to 40 days. So I'm worried about accessibility. I'm worried about sustainability of cost, which is why you went rightfully to 2014. We have 10, 11, and 12, and 13 to get ready for that, which is where the focus of the country needs to be in terms of moving forward around cost, access, and quality sustainability.
Okay, very good. Well, I've finished with my questions. Is there anything I've missed?
I don't think anything you missed. Maybe just a recap.
Okay.
The recap, I see this as a tremendous opportunity for our country to put first and foremost, health improvement is necessary. As a nation, we have a health status that actually is eroding. It's not getting better. So the payment of care when people are sick is necessary, and we do that very well. Others do it well. But in addition to that, you need to focus on reducing health risks and helping people improve health, which just doesn't mean losing weight. It just doesn't mean what you eat. Like everything else, it's moderation. It's moderation of physical activity, what you eat, and how you essentially engage in the healthcare system. That's the important opportunity that's in front of us to create a system that's sustainable over the near term.